Good morning, medical students. Welcome to today's lecture on the topic of musculoskeletal system assessment. In this comprehensive script, we will delve into the intricacies of evaluating and diagnosing various conditions related to the musculoskeletal system. Our goal is to equip you with the necessary knowledge and techniques to perform a thorough assessment, ensuring accurate diagnoses and appropriate treatment plans for your future patients. So, let's begin. In this section, we will discuss the importance of assessing the musculoskeletal system, including history taking, physical examination, special tests, and diagnostic imaging. We will also explore the significance of patient education, communication, and ethical considerations for holistic care. A solid understanding of the anatomy and physiology of the musculoskeletal system is paramount for an accurate assessment. We will delve into the various components of this system, including bones, joints, muscles, ligaments, and tendons. Additionally, we will explore the role of the nervous system in coordinating movement and the intricate relationship between the skeletal and muscular systems. A detailed comprehension of these concepts will enable you to perform a more informed assessment and interpret clinical findings effectively. The initial step in a musculoskeletal assessment involves inspection and observation of the patient's physical appearance, posture, and general movements. This section will outline the specific techniques utilized during this phase, including the assessment of joint alignment, muscle symmetry, muscle wasting, and visible deformities. We will also explore the importance of assessing the patient's gait, which can provide valuable insights into underlying musculoskeletal pathologies. Palpation is a fundamental technique used to assess the integrity and tenderness of various musculoskeletal structures. In this segment, we will discuss the principles and various types of palpation techniques employed during examination. You will learn about the specific landmarks to palpate, proper hand placement, and the interpretation of findings. Moreover, we will explore the significance of differentiating between superficial and deep palpation in diagnosing musculoskeletal conditions accurately. The assessment of joint range of motion, ROM, is vital in evaluating musculoskeletal health. This section will cover the different types of ROM, including active, passive, and resisted movements. We will review the appropriate techniques to assess each joint individually and discuss the clinical implications of limited or excessive joint ROM. Furthermore, we will explore the significance of ROM assessment in identifying joint stiffness, contractures, and other abnormalities. Evaluation of joint stability and integrity is crucial in diagnosing ligamentous and articular pathologies. In this topic, we will discuss the specific tests used to assess joint stability, such as the anterior drawer test, Lockman test, and the pivot shift test. We will explore the principles and steps involved in each test, considering their sensitivity and specificity in detecting ligamentous injuries. Additionally, we will cover the assessment of joint laxity, hypermobility, and instability. In this segment, we will focus on specialized tests used to diagnose specific joint and musculoskeletal conditions. These tests include the McMurray test for meniscal injuries, Neer and Hawkins-Kennedy tests for shoulder impingement, and Phelan and Tynel tests for carpal tunnel syndrome, among others. A detailed understanding of these tests will enable you to accurately diagnose and differentiate between various joint pathologies. Accurate diagnosis requires a thorough understanding of the differential diagnosis process. We will discuss the common musculoskeletal conditions encountered in clinical practice and explore the appropriate differential diagnosis strategies based on the patient's history, physical examination findings, and imaging results. It is essential to consider both common and rare conditions and to rule out red flag symptoms that may indicate more serious underlying pathologies. This section will focus on advanced techniques used to assess joint morphology and anatomy. We will explore imaging modalities such as X-rays, computed tomography, CT, scans, magnetic resonance imaging, MRI, and ultrasound. You will learn about the indications, advantages, disadvantages, and interpretation of each imaging modality, allowing for a comprehensive evaluation of bony and soft tissue structures. Abnormalities in gait and posture can provide valuable information about underlying musculoskeletal issues. This topic will cover the evaluation of gait patterns, including antalgic gait, Trendelenburg gait, and toe walking. We will discuss various assessment tools and techniques, such as video analysis, clinical observation, and specific tests used to identify and classify abnormal gait and postural deviations. Muscle strength evaluation is essential in assessing neuromuscular conditions, functional limitations, and determining an appropriate rehabilitation plan. We will discuss different grading systems used to quantify muscle strength, as well as specific tests, including manual muscle testing and dynamometry. Additionally, we will explore functional testing procedures to assess the patient's ability to perform activities of daily living and identify limitations. In this final section, we will delve deeper into diagnostic imaging techniques used specifically for musculoskeletal assessment. We will explore further advanced imaging modalities, such as arthrography, bone scans, and nuclear medicine imaging. Additionally, we will discuss the importance of selecting the most appropriate imaging technique based on the suspected pathology, patient condition, and desired outcome. Well done on finishing this comprehensive script about musculoskeletal system assessment. We covered a wide range of topics, from the basics to the detailed evaluation. Integrating this knowledge and practicing will help you become skilled in this crucial aspect of medical practice. Good luck in your studies and future medical career.